This soccer or football star actually had a lateral subluxation injury while playing the sport. And so I don't understand why these guys don't wear mouth guards, because it would limit, if not prevent, some of these injuries. So when you have a situation like this, well, what do? Well, first of all, you don't panic. You want to try to push the tooth back in position like the referee actually tried to do, but since he's not a dentist, he just said, well, I'm just going to leave it alone and go and see your dentist. So when we have these teeth are mobile, but they're usually not displaced. Usually if they're displaced all the way out, that's an avulsion, which is different. So you want to splint, if possible, adjust the bite, put the patient on a soft diet, good oral hygiene with chlorhexidine and rinse, and you want to put the patient on antibiotics and bring them back in about 2 weeks. And there's a flow chart you can follow where you have two different types of luxations, whether it's dealing with a permanent tooth or a primary tooth, which is treatment is different. So what are some of the complications? You can have necrosis. You can also have resorption if you don't get into it in time. Subluxation injuries is one of the most common dental injuries, especially in sports. You're either going to have an avulsion or you're going to have subluxation. When you have subluxation, it's very important to immediately get the tooth replanted in position. And the first thing you want to do is bring the patient in, assess the patient, make sure the patient is comfortable. You want to do a chlorhexidine rinse. You also want to take the proper radiographs. You want to take PA radiographs. You want to take occlusal radiographs, especially dealing with some kind of trauma. And also, of course, you want to do a limited field of view 3D CBCT. And you want to make sure there's no alveolar fractures present. And once you rule all that out, you can put the patient on some antibiotics, give them chlorhexidine rinse for about 2 weeks, and if possible, reposition the tooth, and you can splint it with a flexible splint. And then you get the patient back and send the patient to an endodontist like myself, and we initiate root canal treatment. And most of the time we can do root canal treatment in one visit. If you don't get that root canal done within 2 weeks, what can happen is you can have resorption that can take place. Not only just internal resorption, you can have external resorption, even worse, external cervical resorption, which can affect the long-term prognosis of the tooth. So a case like this, you want to make sure that you get that patient back and do the endodontic treatment. And once the endodontic treatment is done, get it restored immediately, and then do a 3-month, 6-month, and 1-year follow-up.